Hello there. Okay, now that you've successfully recovered from your bariatric surgery, it's time to ensure lifelong success. First, let's define success. While many surgeons define success as keeping more than 50% of your excess weight off for 5 years, you, on the other hand, might have different goals. Many folks will have evolving targets that continuously change. That said, whatever your goals are, remember, losing weight is a constant battle. You will battle the hunger and cravings of your favorite food for the rest of your life. Nutrition is something you will need to make a high priority, period. In the end, what matters more than the weight is your overall health. Curing diabetes, sleep apnea, or hypertension are great goals to have. Enjoying life more, traveling, having more energy to play with your kids or grandkids are all majestic targets. And it's important to understand as you work on these targets and goals that our weight is not simply calories in and calories out. All calories are not equal, so make sure you get your calories from healthy food. Now, let's talk some calories. In the first few months, you will eat between 400 to 800 calories per day. As your hunger increases from month 4 to 12, you will probably have about 1,000 to 1,200 calories daily. Still, try not to eat more than 1,200 calories per day until you're at your goal weight. Then, increase your calories gradually until your weight is stable. Now, where do calories come from? The 3 building blocks of nutrition are protein, carbohydrates, and fats. Proteins being the most essential, because if you don't get enough protein, you will lose muscle, and you actually want to increase your muscle mass because muscles burn more calories than fat. Good sources of protein include beef, chicken, fish, eggs, tofu, soy milk, or whey protein. The minimum daily requirement is 60 grams. Did you know that protein serve as a natural appetite suppressant? Yep, so it will make you feel full longer. Carbohydrates, on the other hand, might increase your appetite. Some carbs don't digest properly or don't metabolize in your body. So when calculating daily intake, you should count your net carbs, not total carbs. So what are net carbs? Net carbs are the total number of carbohydrates minus gram of fiber, glycerine, and any grams of sugar alcohol. I know this is boring and complicated. The easiest way to calculate your net carbs is to ask Dr. Google. There are some great calculators online that will help you figure those numbers out. You will want to limit your net carbs to about 20 to 30 grams a day. Fruits and veggies are also carbohydrate, but you still need them. And remember to always eat whole fruits instead of drinking fruit juice, because whole fruits have more fibers. Now onto fats. Not all fats are created equal. Some are actually good for you, and of course some are bad. The easiest rule to remember is, in general, fats that come from plants like olive and canola oils are better than animal fat like beef, butter, or cheese. And strive to eat no more than 40 grams of fat per day. Alright then, next up, vitamins. And let's not let this point slide. You must take these for the rest of your life. Vitamins are dietary supplements and they're loosely supervised by the FDA. So be sure to follow your surgeon's recommendations when it comes to vitamins. Below this lesson, you will find a chart of the ASMBS, our Bariatric Surgeon Society, nutritional guidelines for the surgical weight loss patients. And unfortunately, they are hard to read. My simple advice is to stick to a good brand that offers vitamins that are specially designed for bariatric patients. However, regardless of what vitamin brand you select, your surgeon will need to check your blood levels a few times a year to be sure you're getting everything you need. So to summarize, eat your protein first. Daily recommendations are 60 grams of proteins, 30 grams of carbs, and 40 grams of fat each day. Avoid processed foods. Trust me. Drink 64 ounces of water per day. Do not eat and drink at the same time, and always take your vitamins. Now that we have a plan, let's move on to exercising. And I will catch you in the following video.